Hello, everyone, and welcome to Inflame Medical Magazine. I extend my warm welcome to our guest today, that is Dr. Karan Juneja, sir, who's the General Secretary at Indian Medical Association at the Junior Doctors Network. Welcome, sir, and so tell us about yourself and about whatever is going on in JDN during this pandemic time. How are people working, and also the helpline that are started now for the police and for general public and for the doctors.
It's an honor to join with you, Alicia, and I'm very much happy to give this interview to you and Inflame magazine. And Inflame is working very well for spreading the awareness among the medical students and the general public and the junior doctors. Similarly, JDN has started this helpline, which is focused for helping each and every person in this country. There's also a special helpline running in Tamil Nadu state. We've also started a special helpline for Delhi police so that later on, when our doctors who are working in as residents, who are working in their corporate hospitals, or if they set up their hospitals, these doctors always get a good protection from Delhi police. And they always are safe. They get a safe environment to work and serve. And it's very important that to serve, they have a good environment, work culture. So to ensure that we're doing it with Delhi police, and our Delhi police Jawans need a special care from us. We are trying to do each and every kind of procurement of medicines, be it oxygen or be it a bed which is not available. We help them with these things, as well as we help through our national helpline number also, and one of our Tamil Nadu state's helpline is going on. And JDN is working on frontline as well as on helpline. And many of our junior doctors who are serving in the day in ICU, they serve at night in the helpline. If they're serving at night on the front line, they are serving in day on a helpline. So it's going very well, and I'm very happy that you are also joined Junior Doctors Network, IMA Junior Doctors Network, in this fight against COVID, and you are working very enthusiastically, providing us with all the verified links, and it's a great use because it's a lot of confusions also happen. So you help us to clear those confusions, and yeah, it's a great opportunity to serve, and we are committed to serve.
I'm really honored that I got an opportunity to serve doctors, policemen, and even general public with the helpline and with your support. I'm so grateful today that you joined us with even all this hectic things happening around. We are really, the Inflame family really thanks you and honors you for coming and joining us today. So we have certain questions on the ongoing pandemic, and we would like to, get answers from you. So with your permission, shall we start?
Always ready.
Okay, sir. So my first question to you is, what is your opinion on the protocols and the general policies that are laid down by the central and the state government during the COVID management?
Well, the central and state policies and the protocols are very well elaborated, but there is a need of a coordination between center, states, as well as there is a need for good policy makers, and that's why we have started our Twitter storm via IMA JDN, which was one of the trending topics on 5th May on Twitter. At 5 o'clock we started the Twitter storm. It was trending till the prime time, and it is still trending. And people are asking for good policy makers to come up in Indian medical services, in politics, in good posts, so that they can actually understand what the problem is and actually do proper resource allocation, resource management, and work diligently in this field of healthcare. And a good healthcare at this moment is need of the hour. So I think there's a need for a good coordination also between center and state, as well as good policy makers to make those policies. And I hope it happens. We have seen the second wave, until the third wave. Hope it does not come, but I think policies will be implemented very well. And the basic root cause is that our public needs to be aware that they should follow proper social distancing. They should be wearing masks when they move out. They should not burden in the hospitals, so that these central and the state and the doctors are not burdened. And at the end, we don't have to see the scenarios which we had seen in April, or which we're seeing right now, April end, or which we're seeing now right now. So it's very important that the public learns a lesson and tries to follow these policies. It's because governments can give policies, but it is up to you. It is up to the citizen of this country that they have to implement these policies in their daily life. Yes, next question.
Yeah, definitely. I think even our countrymen should learn on how to wear mask, and even when they are vaccinated, they should wear mask when they are in crowded places. So there are little guidelines that people need to follow, but they do not, and they end up in the hospitals. So even the Indian medical services, it is the need of an hour, and I think it is must, and it is already taken up by IMA as an issue, and I hope people would be also joining us, and the government would also do on their part. So following up, the next question that I have is recently the Madras High Court, they slammed the election rallies and the commission for allowing the rallies, right? So they gave a particular statement which I'm reading out, that is, your institution is singularly responsible for the second wave of COVID-19. Your officers should be booked on murder charges probably. So how far do you think this statement is 100% correct, and what are the other reasons that the second wave came into existence, and even there are rumors of the third wave coming up next, so how dangerous it can be for the children. So I just want you to explain all of that, like what are your views on that?
The election commission definitely should have actually not elaborated this election such a long time. The election was going on in Bengal for a month, in various states for a long time, and election should not have been happening at this time. It was government's decision. Government should have been proactive. There should have been a good coordination that we can delay the elections. Like we are postponing our NEET PG, we are postponing the PG exams. We could have postponed the elections, and I think the election commission should have conducted this election in a very concise manner. In 3 days, 4 days, if it was possible, the election could have been done. Proper social distancing should have been ensured. But I think equally public was responsible, which was attending the rallies. The political leaders were important, who were pulling these huge crowd. So I think it was a collective. It's a collective failure. I'll say it's a collective failure of everything. And courts must not do legislature like the way legislature should be left to the parliament, to the legislative assemblies. Courts must be the advisory bodies. Courts have advised that incentivizing NEET PG exam, but I think that's not a very good move, because if you'll start incentivizing, it will create an issue for the merit-based people who are studying for such a long time, and they are still studying. And if someone comes with a fake certificates, and in this country you can get a fake certificate made anytime that you have been serving, so it will be a big issue. And this is a big concern that courts don't know the ground realities. Actually, sitting in a court, you cannot give an advice. And the government should have postponed that election. And right now also, if we see, the government should actually view the way that the kind of budget they are spending on publicity, the budget they are spending on Central Vistara project, the budget they are spending on other issue, on other advertisements, media coverage, on other events, on getting the roads, highways built. They should spend that money for building the good healthcare infrastructure, or upgrading that existing healthcare infrastructure, doing proper resource management, recruiting the doctors. And I think IMA JDN is very much actively working with Delhi, government of Delhi, in recruiting junior doctors, getting them jobs availed. And at this time, it is important that we be prepared for the third wave. Let's hope for the best, but prepared for the worst. And as you said, this third wave is predisposing children, and children are at big risk. And because schools might be opening later on, and if that happens, schools might be the epicenters. Schools might become the new epicenters, and we need to be very careful. And proper strategies have to be jotted down at this moment, because our failure was very much prominent during the second wave. It should not be in the third wave, and we are ready to formulate the guidelines. And as a public health expert, I can say this thing, that right now the top priority should be, ending the second wave and not letting a third wave generate again, and protecting our young children are the future of India.
Great. I think the third wave is going to affect children, so that as you mentioned, the schools would be the center of spreading the infection. And that would be really tough. And I hope there are certain things that we can come up and, stop the third wave, but it is not seeming to be that way. Anyways, let's move to our next question.
I'll just add on here that virtual education needs to be promoted in schools, so that it's not easy that we send our children again back to schools. Virtual mode of education is very successful and should be continued in schools till the time the second wave ends, and till the time we are sure that each and every person is vaccinated. Till the time we need to go for a home vaccination like we had during pulse polio. Vaccination was done at the doorstep. Vaccine should reach your doorstep for the children also. Calling them to a vaccination center and saying that sorry, the vaccine is not available, it's not a it's a big blunder, and that vaccines are not available. People are crowding, and when there is a tsunami coming, we are asking people to go to the seashores. They should be safe, staying safe inside our home, and our help, our aid should be going at the doorstep. The vaccination should go to the doorstep, and especially for the children, because it's a big concern, like you have mentioned. And I think pediatricians need to be trained in advance, and in fact, gynecologists, anesthetists who are, because right now a lot of cases were coming of pregnant females also. A doctor, I'll just tell you, if you have seen that video, it's a very emotional video that a pregnant doctor, she lost her life, and she was carrying a, I think, future of India, I think a beautiful child with her. And she, at the end, what the message which she gave, and it made me really very emotional, that you should practice social distancing, be aware, be alert, wear a mask. Because you are, not only you are at risk, you are making others also at risk. So I think we should, before this third wave comes up, we should do this proper risk assessment and work on actions and solutions. It's a very, or else it will be a very alarming situation.
Sir, as you mentioned about vaccination, so as you said that the vaccination is really important, then government has also announced that above 18 years old can get vaccinated from 1st of May. That is already started. So what are your comments on that, and how well is it organized and executed? Any comments on that? Because there were also certain article pieces in newspaper and social media, every day around, that the vaccination centers are not having the vaccines and it is supplied to the other countries as well. So what do you have to say about this?
See, vaccination should be available to each and every one. We were saying this not only from 1st of May, it should have been started from 1st of April. We were already 1 month delayed. We delayed that vaccination. We should have, instead of helping other countries, we should help ourselves first. IMA had previously also in the press release asked that vaccination, even in the meeting with the Prime Minister also, there was this issue was raised. The vaccination should have been taken on priority much earlier. And now that this drive is going on, I think I have mentioned previously also that it should reach to the doorstep. That instead of the people crowding at the centers, vaccination or the workers should be allotted an area, a sector, a community center. From that community center, they should be in contact with the local pasha, local RWA president, local whatever, any local good political body, a local NGO, or a good social, and they can reach to each and every doorstep and get this thing done. Because vaccines are really not available also in many centers. What I found, people go, they come back home, they are getting infected. People are pressurizing us. A lot of VIP culture is there. People give a call to us that you please get us vaccinated, please help us. A lot of top notch, a lot of ground workers, I'll say, are still not getting vaccine. Our house helps, they are struggling, they are begging us for vaccine. I am also facing this problem. To which center should I send them? Where should we actually move? This vaccination strategy, I think I'm not against vaccination, but the way this vaccination program is going, it is, I'm not still against it, but I think it should have been, it should have been made more efficient. Efficiency needs to be there, uh, that you need to you need a good policy maker for that. You need a very good policy maker for that, and a very robust mechanism, so that we can ensure that if a person is coming, he should be vaccinated vaccine should be available in all our centers. There should be more and more number of centers. So okay, we should need to engage more and more people in this program. Be it, I think, any social worker at this moment, he should be trained how to give vaccine. He must be trained. There should be now that we should send them to home. We should make sure that there is an ambulance available nearby if there is any adverse effect. There should be a proper monitoring done. There should be proper counseling done. We need a lot of counselors also. We need a lot of political leaders to come and open the way they were campaigning during election. They should come up in that same way and campaign for vaccination, which is the need of the hour. Yeah.
So as you mentioned about the ways the vaccination campaigns are occurring, so I see even in my area, there are booths that are set up for vaccination, like in the streets and or at any place like near the hospitals or any general public place, right? So a lot of crowd is occurring over the place, and people are actually getting COVID because of the crowd. And there's a misbelief that when you get vaccinated, due to that the COVID is being spread. So what are the particular things that one should consider when they are going and taking the vaccination, because that is already started now? And how better do you think this can be made, like the vaccination programs can be made safer for the general public?
I think the people should first confirm at the center before going that vaccine is available or not. If they have got it allotted via the app, they should contact that local hospital, contact that local center before visiting there. And before visiting there also, they must wear proper mask. And even after getting vaccinated, the mask should be, they should wear the mask. They should practice social distancing. They should be wearing their gloves when they're going to that center. If they don't have gloves, proper PP kits, if there is a problem in doing that, they should at least, when they're returning back to home, they should take a hot water bath, or they should take a bath. Okay, that we have came out from such a crowded place. Okay, they should do proper hand washing while going, while coming, after getting vaccinated. They should carry a sanitizer with them, and I think they should learn the proper steps of hand washing. And when they're at center also, no, they must realize that if the vaccine is not available, it's not the fault of the healthcare worker over there, or it's not the fault of the doctor over there, or it's not the fault of the government. It might be some logistical issue. It might be some issue. They should understand and not create a havoc over there, and not instead create a crowding over there. They should return back. And I think make sure that wherever the vaccination is available, when it's available, they should go and get themselves vaccinated. But it's important to get vaccinated, but it's equally important to get safely vaccinated. And that safety you have to ensure, that when you're going, your safety and the safety of your colleagues who are standing in that with you, your brothers and sisters, they are just like your brothers and sisters. You should make sure that if they lose their family, if you are infected, you should not be going there. If you have any symptom, you should do the prior triage before going over there. And if you have a family member who's suffering, you should not be going to the centers at that moment. And I think properly there has to be a accountability of the local leaders, of the political leaders, that this is the time, this is the need of the hour, that if you have been elected to serve, you should make sure that vaccination is available in your area, in each and every booth. The way you used to ensure that each and every booth, you have a karyakarta, you have a worker, you should make sure that you have a worker, that karyakarta, working for getting people to that center, for getting him vaccinated, for sending him safely. It's a collective effort, from citizens, from leaders, from healthcare workers, from doctors, from administrators, from government. And I think till the time all these pillars don't stand at all, the building will fall. And I think we have fallen once, we cannot afford falling again.
Great, sir. As you mentioned that one should also take care of the hand hygiene and practice hand washing. I would also like to mention that IMA and its networks like MSN and JDN both collectively did go to some hospitals and actually taught hand hygiene. So that was a really great step, that you are also making others aware of the hand hygiene and healthy practicing of hand washing. So Again, moving on to next question. When we already talked about vaccines. Now, I would also like to talk about the virus, the infection that is going on. So there is, people are worried, there is stress, there is fear, and they think that they would also get the virus. And in that fear, people are purchasing a lot of drugs that are not needed. For example, remdesivir, a lot of black marketing was happening in between. So, how do you think this could be avoided? And even a lot of, healthcare workers were also involved in black marketing of the remdesivir, maybe pharmacist or maybe any health worker. So people are also losing trust in the fraternity, like because of the lack of resources. They think that doctors are actually behind it, but it is not the scene. So, what do you would like to say upon this issue that is going on?
Well, Alicia, I would like to wind up this interview with a very interesting quote. Okay, that when the resources are less, your management should excel. Okay, our resources are less, and I think managing it is it should be excellent. Doctors must use the remdesivir and the other drugs judiciously. IMA also advised it to be used judiciously. Remdesivir should be used judiciously. It just reduces the stay in hospital. Fine. And if you can afford it, that does not mean you start black marketing it. You just start roaming here and there, get crazy for getting that drug. Fine. Your patient just needs early oxygenation, steroids, which are life-saving drugs. Life-saving drugs are available. You should save your life and stay inside. I see the families of COVID infected patients standing outside the pharmacy shops, calling us, using each and every form of political power, using medical power, using all the resources and getting the drug procured. Instead, they are exceeding this disease. They don't get themselves tested and spread the infection. They are burdening the doctors. They are burdening us on helpline. They are burdening us on phones, messages, WhatsApp, morning to evening. And I'm like, but you should realize this thing that when you are being given a good treatment, you should trust the doctor. And doctors must also, at this moment, I like to use this platform to say, not advise these drugs when they are not required and they are not available in their hospital. And they know that it is tough for the patient's family. We must judiciously use these drugs, and we must not pressurize the patients, because I see that oxy patients are roaming here and there, paying in lakhs. Remdesivir, they are, after which, when you know that the patient can recover on steroid, if it's a severe case, definitely. And if the patient can afford it, definitely you go ahead. And I think the government has also made sure that it's available via the in all the government hospitals. But not only in the government hospitals and all the private hospitals, there has to be a proper resource management that it reaches also. You cannot just say that you go to the nearest CMO office, go to the DM office or SDM office. The doctors cannot get it procured from there. So they are being forced to reach out to these MRs, to reach to these people, to reach to other doctors who are engaged in this business. We must end this business, this piling up of oxygen cylinders. Once you have recovered, return back that oxygen cylinder. If you have SpO2 above 95, please don't pile up oxygen cylinders at your home and you're COVID positive. If your family has anyone needs oxygen cylinder, they will be given oxygen cylinder. Think this country as your family. Fine. If you are piling up the cylinder. If someone in my family gets positive, he might need it. You are keeping full oxygen cylinders with you. Your SpO2 is in 90s. You are still roaming some 90s, 95. You are still roaming that I need a bed, I need a bed, I need oxygen, you sleep in the prone position at that moment. You are running, you are haphazardly moving here and there. You are exerting yourself, you are exerting the patient, you are making the condition of the patient severe. So it's a very important thing that as we end today's session, Alicia, that the message should be going clear to the doctors, to the public, and to the each and every person listening to us, that please, we know that the resources are less, but let's manage it with in an excellent manner and win this fight against COVID. And I think with young medicos like you coming up, and we are in safe hands, this country is in safe hands, and I hope the day is not far when you lead the Indian Medical Association, this beautiful country of India, or I think be a good policy maker rather than we both sitting here and advising. Who knows, one of us might be an Indian Medical Service officer one day. And I think we must keep inspiring and keep studying and keep helping as much as we can, so that, the day is not far that I think the country will realize that we had a prime minister like Manmohan Singh who got economic revolution. We might need a prime minister who gets a healthcare revolution. We might need a true doctor who can get a healthcare revolution as a health minister. We might need a good Indian medical service officer at a district level who can really revolutionize the things. And I think for that, it's important to become a good doctor. It's important to pursue your post graduation. It's important to work for your profession, to work for your community, to work for fraternity, and to always serve to those people in need and be friends indeed.
Great. So your views are really amazing, and I hope some of them would be taken up by people around, maybe some NGOs, and they can start the empty cylinder campaigns and all that you have said. The management of resources is the need of an hour, and the doctors who are listening to this would definitely take a note. So thank you so much for joining us today. It was really nice talking to you and taking your professional and experienced views on the questions that we had. Thank you so much.
It's an honor to join. Thanks so much for this lovely session. It's lovely to talk to you. But let's talk less and work more, study more, and let's be an asset to this country. All the best. Best wishes to you all.
Great. Thank you everyone for watching. Stay safe and stay home and keep learning.